Good day everyone, welcome back to my channel. Today we'll be talking about CPR and steps to CPR. Now let's know the meaning of CPR. CPR means Cardiopulmonary Resuscitation. This is an emergency treatment done when someone is unresponsive, or when someone has a cardiac arrest, or when someone stops breathing or has abnormal breathing. So we'll be talking about the 7 steps of CPR today. First step is call 911. Before starting CPR, it's better to call 911 for a medical help to arrive, because CPR is not done to cure cardiac arrest or any medical condition. It's just done to keep the victim stable till medical help arrives. Now the second step is assessing the scene of the emergency. You need to assess the scene of the emergency to know exactly what happened at the scene, to avoid wasting time and to avoid putting yourself in danger or putting the victim in further danger. So you have to make sure that the scene is actually safe and okay before you start performing CPR. And the third step is opening the victim's airways. You have to make sure the victim airway is open by lying the victim down by the back, inside the jaw. Then you make sure the victim's airway is open before starting the CPR. Now step 4. Step 4 includes checking for breathing. Now after opening the airway, the next thing you do is to check if the person is actually breathing or not. Now you lower your ear over their mouth and listen for about 10 seconds. If you don't hear or see any signs of breathing, immediately begin CPR. If the victim is occasionally gasping for air, you should still begin CPR. But if the victim is unresponsive but breathing at a normal pace, then there's no need for CPR. But you should still check for breathing, because at a point the patient might actually stop breathing. Now the step 5, 30 chest compressions. After checking for breathing, the next thing you do is to start the chest compressions. This is how you start the chest compression. You place one hand over the other, you interlock your fingers, place your hands on the center of your chest, just below the breastbone. Straighten your arms, apply your whole body weight and press firmly at least 2 inches deep with compressions at a rate of 100 to 120 per minute. Then allow the chest to rise between compressions. This is how to do the chest compression. Now we'll move over to step 6, which is rescue breaths. Now after chest compression, the next thing you need to do is to start rescue breath. First of all, you ensure the airway is still open by tightening the head back and slightly lifting the chin. Also ensure to shut the nose shut and place your mouth afterward for rescue breaths. Make sure that the airway is open and blow into the victim's mouth. Give 2 rescue breaths and watch their chest to see if it rises, to ensure that their airway is still open. If not, you may need to reposition the airway. Make sure to use your body weight, not just arms. So this is how to give rescue breath. You make sure you use your body weight. Don't just use your arms, but use your body weight and blow air into the victim's mouth. Now step 7. This is repeating the cycle. This includes repeating the chest compression and the rescue breath. Though some experts might say that rescue breath are not really necessary, that hence only CPR, which is the chest compression, is actually very effective for CPR. So sometimes the rescue breath may not be necessary, but you keep doing this till medical help arrives. You keep doing the chest compressions and the rescue breath till medical help arrives. Now let's talk about when CPR is actually needed. Like I said earlier, it is not actually needed in all conditions. CPR is needed when a victim is unresponsive, when the victim is not breathing, cases like cardiac arrest, cases like drowning, suffocation or poisoning. These are when CPR are needed, and there are some criteria before you start CPR. We don't just start CPR on anybody. First, you have to check if the person is unresponsive, if the person is not breathing, or if there's a lack of pulse. So these are reasons why you should start CPR in the first place. CPR is not just something you just start immediately, something you check and know before you start. You don't do it in all conditions, so you have to be careful when performing CPR. So it's better you get certificate of performing CPR, and also help to let others know that CPR is actually a very important technique. You must not be an health professional to know how to give CPR. So please learn and also help people around you. Thank you for watching. Please don't forget to subscribe, comment and like my videos. Please, if you have something you want to add to what I've said, please don't forget to write them down in the comment section so that we can talk about it next time. Thank you.